Most doctors believe growing online is about posting more frequently or spending more on marketing. But I think it's about understanding how attention works. If you can capture attention and then keep it long enough to deliver practical health education, listen, you've cracked the code. And in 2026, it's pretty clear that 5 to 10 minute videos give you the best shot at doing this well. So today I'm going to share with you a simple framework with examples you can use to draw patients in every time you make a video. It's what the most successful doctors use, whether they realize it or not. My name is Ryan, and for years I've helped doctors help more people and cut through the noise of trying to attract patients online. So without further ado, let's get into it. Recent data suggests on average you've only got 8 seconds before someone decides if they want to watch your video or click away. If they get past that early decision point though, into the first minute, they're far more likely to watch half the video or more. That's why the beginning of your video is the most important part. And for the sake of this video, we'll only be covering what you say in your intro. Now here's what many doctors fail to realize though. Those that do better on YouTube aren't necessarily better at medicine or better health educators, but they've got their intros down to a science. There's a pattern that they use. And once you see it, you can't unsee it. And once you understand it, you can use it in every video you make. Now let's go into those 4 parts that make a compelling intro to draw patients in. First and foremost, make the point of your video clear and who it pertains to. So in those critical first few seconds, the viewer is subconsciously wondering, what is this about and who is this for? So your goal and your job is to state the point of your video clearly, use descriptive language, and speak to what they desire, right in those opening lines. You're starting to paint the picture for them. Now let's look at a few examples of Seth Capehart of Capehart MD. His video popped on my feed one day, and he does a great job at this right in the beginning lines. Example number 1. This video title is The Real Reason You're Aging Fast After 40. And the first line goes, aging is inevitable, but how you age is entirely up to you. Some men hit 40 and start falling apart, losing muscle, energy, and drive, while others stay strong and sharp, and you get the point. But the first line, he makes it clear the video is about how you can control how you age, and then he speaks directly to men 40 or older. And the next example, same thing. The morning routine that skyrocketed my testosterone levels. The first line goes, all right guys, if you want high testosterone, more energy, and better performance, it starts first thing in the morning. The way you wake up, what you do in that first hour, and how you set up your day all play a huge role in optimizing your hormones. Last example, how I easily stay below 15% body fat year-round. Staying under 15% body fat year-round isn't as hard as you think. In fact, it's pretty damn easy. I'm 40 years old, I've got 4 kids, a full-time job as an ER doctor, yada yada yada. And just like that, in the first few lines, he makes the point of his video clear, he speaks to their desires, and he uses descriptive language, keeping them engaged to the next few seconds of the video. Next, and the second thing you want to convey in your intro is that you want to help the viewer, your potential patient, understand why they should care about what you're talking about. You're continuing to paint the picture for them here, and you're showing them why this matters to their life. You're not trying to scare them or hype them up, but you are raising the stakes and playing on their fear or their hope. You can do this by briefly surfacing what's at risk if this is ignored, or what's frustrating or limiting about the current situation they're in, or why this problem tends to get worse without the right approach. Now, Capehart did a great job of this in the examples that we looked at earlier, so let's go back to those. In this first one, he illustrates 2 separate paths. So some men hit 40, start falling apart, losing muscle, energy, and drive, and others stay strong and sharp and full of life into their 60s, 70s, and beyond. So right away, he's playing on what will happen if you don't take the right approach. In the next example, he goes on to say that most men are sabotaging their testosterone without even realizing it, making you think, am I sabotaging my testosterone without even realizing it? Keeping you interested and engaged. And in the final example, he says that you've probably been told that staying lean after 40 means giving up everything fun. Well, they're wrong. And what this does is it plays on the common frustration that people have when it comes to losing weight and staying lean. And just like that, he accomplishes point 2 of a successful intro. Third, you're helping them believe that change is actually possible. So you're answering the question that they're having, which is, can this change for someone like me? So you do that by highlighting someone who's achieved the desired outcome. That could be a group of people you regularly see improve. It could be patients you've worked with, or yourself if it's relevant. Capehart did a great job of this in one of his intros where he said, I'm 40 years old, I've got 4 kids, a full-time job as an ER doctor, and I've stayed under 15% body fat since high school. So he talks about himself, how he can do it with these circumstances so you can as well. For the fourth and final piece, you just want to simply provide a quick breakdown of what you're going to cover in the video so they know what to expect, and then just a line or two introducing yourself and your credentials to provide that credibility and trust. And now that we have all 4 parts of the framework, let's stick with Capehart and watch an entire intro of his to see how he puts it all together.
Aging is inevitable, but how you age is entirely up to you. Some men hit 40 and start falling apart, losing muscle, energy, and drive, while others stay strong and sharp and full of life well into their 60s and 70s and beyond. I've seen men in the ER in their 90s who are as spry as men in their 50s, and men in their 40s who look like they're in their 90s. The difference? They understand the science of aging and how to fight it, whether they realize it or not. Science shows that you can slow down aging and prevent muscle loss and boost energy and even keep your testosterone levels high with the right strategies. And today I'm going to break down exactly how to do that. I'm Dr. Seth Capehart. I'm an emergency physician, a former military special operations guy, and I've spent the last 20 years studying human performance and health observation.
Now, after watching that intro video, do you see how it's effective for men around 40 who are worried about aging? Do you see that he answers those same subconscious questions that we all have when we're wondering whether or not we should watch a video? Now that you know this framework and you can identify the pattern, I encourage you to look for it in videos that you watch in the future. And I even encourage you to try it for your own videos too. I think you'll see great results.